Music. You can listen to it anywhere, including this video, and since it comes in various genres, there's a music piece for just about anybody. You can use music to get fired up, or perhaps chill out, or even connect with friends. But what if I told you that there was another way to use music? Say, improving motor skills, communication, or perhaps social skills? Well, you're in luck. I'm Steven from Tostemac, and today's autism video is about autism and music therapy. This video is going to be extra special because I have invited a special guest to help educate us on this topic. After all, if we're going to be talking about something like music therapy, we need an expert in the field. And admittedly, my expertise revolves around playing Amazing Grace on the piano. And even then, maybe. Who is this expert, you may ask? Let's not wait any longer. Special guest, please introduce yourself.
Hi everyone, thank you so much for checking out this video. We're going to talk about all things music therapy today. So my name is Bonnie Houpt, and this is my cat Queenie, who will be joining us for the video today. And I am a board certified music therapist that's going to talk about and answer some questions about all things music therapy today.
Awesome. Thank you so much for taking time to be a part of this video, Miss Bonnie. And you too, of course, Miss Queenie. Now, as Miss Bonnie mentioned, I have come up with a list of questions for her to answer that are commonly asked about music therapy in order to cover as much ground as possible. Starting with the first one, what exactly is music therapy?
Music therapy is a pretty big field of certified clinicians that use music to reach a clinical goal. So this goal could be a motor goal, a communication goal, a social goal, an emotional goal, a sensory goal, depending on the needs of the client and the population of the client. Music therapists work with a variety of populations. I work myself with individuals with disabilities, but you'll also find music therapists in hospital settings and also in mental health settings. So it really just, it will look different from setting to setting, but the kind of main thing music therapy is using that music to reach that clinical goal and then implemented by a board certified music therapist. So for example, one goal I've had with clients is to maybe increase grip strength and duration. So I might have like an egg shaker song where we hold an egg shaker for a certain amount of time and then release it, and I track that data. Another example is if we're working on a communication goal, different songwriting and sing-alongs could be used to elicit kind of vocal exploration. So I've had clients where we might, Old MacDonald is a quick example for kids with the E-I-E-I-O, but there's also a lot of songs that I write myself that kind of can elicit different vocalizations and improvisation with vocalization to kind of work on kind of that base communication skill of it, just exploring our voice and that self-expression. So that's a little bit about what music therapy is, and I'm sure we'll get into it more with some of the rest of the questions.
Huh. Interesting. To be honest, I never really thought about music being used this way, but while it's important to know what music therapy is, it's equally important to know what it's not. With that in mind, what are some common misconceptions about music therapy?
There's a couple. One is you definitely don't just listen to music and it's music therapy. There's some listening programs out there that is a little more of that receptive kind of input to work on a goal, but those sound programs aren't necessarily music therapy. A lot of times OTs will be trained in those sound programs. So listening is definitely can be therapeutic and can be an aspect of music therapy, but it's more than just listening. A lot of my students and clients do a lot of very active music making. I bring in different instruments and we use kind of instruments for improvisation, to recreate songs, to write songs, to sing along to songs, because there's so much that can happen when we actively make music and make music together. So listening is a part of music therapy because there are benefits to listening to music, but it's more than just listening. You also need a board certified music therapist and to have that relationship in therapy, because a lot of what's happening therapeutically is the therapist implementing these music strategies to elicit the responses and the kind of objectives that they're assessing for their clients and setting up with the clients in that assessment period. Another very common misconception is I'll have families be like, oh, well, my child doesn't play an instrument. And that's okay. You don't have to be a musician to benefit from music therapy and experience music. So that's another really common misconception about music therapy.
Those are some good clarifications. In other words, there's more to music therapy than just listening to your favorite tune. It requires a lot more engagement from you and the certified expert. Moving on to the next question, what are some benefits from music therapy and who can benefit from this?
So I touched on this a little bit before. There's definitely different populations that can benefit from music therapy and that music therapists commonly work with. Music can be beneficial in that it's been shown in studies to reduce pain. So in hospital settings, music therapy is used a lot. In that aspect, music therapy can also be beneficial for individuals with disability or with autism, as music's a way to really express yourself where you don't necessarily need words. And I feel like that could be really powerful for some of the clients that I work with, where music is its own form of expression that we can all tap into. It is so accessible. So that accessibility is such a great benefit of music therapy. And music therapy is also beneficial in the fact that music really affects all kinds of areas of the brain. So that's why we can work on speech goals. That's why we can work on motor goals. Because when we hear music and make music, different parts of our brain are activating. That's been shown in studies. So it's not just necessarily this one part of the brain. Music very much affects the brain. And another benefit of that is that there's been studies found that even when looking at an autistic brain versus a non-autistic brain, that they still could synchronize to music and the brain was affected the same way, and they can synchronize to that beat, and you can improve your synchronization to a beat if it's not completely exact, but that's still accessible. So again, that neurological accessibility is such a huge benefit of music therapy, as well as the benefit of it's fun. So a lot of people enjoy music, and usually my clients have a lot of fun in sessions. So even though we're working towards goals, it is therapy. We're here to improve something, whatever we've decided between the therapist and the family and the client. But it's fun and it's motivating, and that's such a huge benefit of music therapy, knowing that there's this fun way to try to kind of improve our lives and get that quality of life. And then who can benefit is definitely anybody who likes music and has something that they think music could be used to improve.
So not only does music therapy offer great benefits, it's also accessible, which I know will make a lot of parents very happy. And it's fun. I mean, come on. Who doesn't love fun? Anyone? Anybody? Nobody? Okay. Here's a question that I feel needs to be asked about this. What about individuals who have a hearing impairment of some sort? Could they benefit from music therapy?
This is a great question, and the answer is yes. I've worked with some individuals with hearing impairments in the past, and a big aspect of this is that the vibration becomes such a huge aspect of it. But really, individuals with a hearing impairment can still experience music so physically and sensory-wise. So drumming is really great for clients with hearing impairments, and they can definitely benefit. As a music therapist, it's important to be aware of what instruments you're using, what visual supports you're having for these clients, so that they're experiencing the music as much as possible, but they still can definitely benefit from music therapy, from these goals. It might look like a little different, a little adapted, but they can still really experience, especially that sensory input of music, and as much as their peers, 100%. So then, whatever goal they're working on, you can still use that music to work on it, and just knowing you might have to adapt the music a little bit to fit how they experience the world, like I do for other clients too.
That's incredible! The reason I had to ask this question in particular was to make sure no one was left out. So, not only can individuals with a hearing impairment gain something from music therapy, it also provides another way to enjoy music. Just because you can't hear the notes doesn't mean you can't experience the sensations throughout your body. Alright, how about this one? We know there are all kinds of music genres throughout the world, but what kind of music is commonly used in music therapy?
This is another great question. One thing that we're taught as board certified music therapists is to use client preferred music. So a lot of studies have found that songs that are more relaxing, songs that are more motivating, songs that are more effective tend to be the preferences of whoever you're working with. So in this way, music used in music therapy very commonly is popular music, country, rock, pop, and then whatever genres an individual likes as well. So, whatever those popular genres are, you'll see that in music therapy very often too. Rap, R&B, hip hop, and then some classical music too. And then again, that's client preference. Some clients like classical more than others. Some are trained musicians sometimes, and then in that case, classical would be really appropriate. But those are the most common. And then from there, you can definitely expose your clients to different varieties of music. And I find, especially in group music therapy, this is a lot of fun too, where most of the time I'm using the songs that they prefer, and then every now and then bring in one that maybe they've never heard in a different kind of genre. And then we can discuss, did you like that? Like, there's different kind of therapeutic aspects of that. You could work on communication. You could work on communicating likes and dislike, and even communicating preference, or kind of emotional kind of goals could be tied to that of how did that song make you feel. So there's definitely room for different kind of songs, but really for me, probably anything's game for music therapy, and then just those popular songs tend to be the most common.
It's certainly good to know that you don't have to be restricted to music genres that you might not like. By choosing which music pieces you get to listen to, along with throwing in a new one here and there, you can personalize your music therapy experience and make it all the more special for you. Now here's a question that you actually touched on a little bit earlier, Miss Bonnie, but it does need to be addressed. Can anyone practice music therapy, or is it only certified experts?
And it is only qualified individuals. A music therapist is somebody that is a board certified music therapist, and that credential in the United States is MTVC. So to get the MTVC credential, you have to go to an approved program for an undergraduate bachelor's degree in music therapy. So certain universities have this program kind of established by our national association, the American Music Therapy Association, AMTA. And those universities that are approved by AMTA have these programs that you go through, which is 4 years of classes, and then an internship that's at least 6 months after that. You have to do the internship. And then once you finish your internship, you have to take a test to become board certified through the Certification Board for Music Therapy, which is CBMT. And then after you pass your test, you are a certified music therapist. And once you're board certified, you have to do continuing education credits and get a certain amount every 5 years to keep your credential. And as board certified music therapists, we are trained to use music therapeutically to develop a treatment plan and assessment and track data for our clients, and to really respond in the moment and be flexible with clients and watch for how music's affecting them and adjust in the moment if we need to, and all those kind of flexibility aspects of being a music therapist is what we're trained to do. And that makes us a little different than a performer. If I do like a group for adults with disabilities, what I do is that instead of like just singing through my songs and that's the set, I'll have a plan. I'll bring in some songs, but if I see somebody who wants to play guitar, I might let them play my guitar while I'm still singing. If somebody's like, oh, I really want to listen to this song, we might throw that into the plan. Like, it's very flexible so that it's collaborative and that we're making music together.
The second to last question is something that I know is going to be on a lot of parents' minds. How much can it possibly cost for these music therapy sessions? And are there financial options for families that might need financial assistance?
So this question's a little tricky, as music therapy is going to cost differently kind of depending probably where you live, like cost of living a little bit, because private practice music therapy can set their rates, right? So this private pay could really vary. I think a typical price could be anywhere from like 80 to 100 an hour. And again, this can vary very greatly depending on the situation. And then there are definitely financial options for families. So if we're talking about individuals with disabilities or autistic people, ways to kind of finance this music therapy. In Colorado, if you have the CES waiver or the SLS waiver, this can be covered by that Medicaid waiver under movement therapy currently. We're working on trying to change that wording so that it reflects music therapy instead of movement therapy, but right now it's under that. So definitely if you have a CCB and a case manager, ask them what your options are, because sometimes music therapists can bill this waiver. I myself take private pay, so sometimes I work with community boards to work with the individual funding. And that can look like having different sources of funding through the community board. And this is so different, like case by case, I find. So just really talk to your case manager is one of the greatest options. And then there's some nonprofits that offer music therapy. So that's something to consider looking into as well, because they might have that kind of funding option. And a lot of music therapists also really try to provide a sliding scale if they can. Can't speak for everybody, but I know that is common or can be common between private practices. I know that I have my own set rates. I take private pay, and then I work with some of those Colorado community boards to either whatever funding they have, or sometimes they can build a waiver for me, and I'm more of a contractor. So it just really depends case by case. But the options are out there, so to look, and for grants and sponsorships, I look for that myself as a business owner, so that we can make these services as accessible to families who are looking for them, because it definitely can be tricky financially sometimes to afford services when there's other services going on too, other needs that your family has. So definitely talk to the music therapist you're interested in, talk to your case manager, and there's definitely options out there.
Okay, this last question is just for you, Miss Bonnie. If you were to talk to someone right now who was on the fence about music therapy, what would you say to them?
For me, the biggest thing is, does your child love music? And if the answer is like a resounding yes, like they respond so well to music, they sing all the time, they love listening to music, they love playing music, that's when I'm like, yes, we should definitely do it. Like, this is definitely going to be a good fit. We will find a way to work on our goals therapeutically, because music is so motivating and so fun. That's what I really would tell families on the fence. And then on the flip side, if your kid is like not interested in music, we can do an assessment like session and see how they respond, see if they like it. But if like they don't like music therapy is probably not the best medium. And there's other creative arts therapies to look into: drama therapy, dance therapy, poetry therapy, art therapy. So I would maybe recommend that, maybe even OT instead, occupational therapy. That's kind of the biggest factor for me when families are like, is this gonna be a good fit? And is like, how much does your kid like music or not? And then do that assessment session. And then a lot of music therapists I would do as well offer like a free consultation, so we can talk on the phone through any questions. And then there's usually an assessment period that I offer where it's like, hey, let's just do one or two sessions, see how your child responds. And if they hate it, we gave it a go, and if they like it, then we can really move into working on goals through music.
And there you have it, a great rundown on music therapy and what it can offer you. Thank you so much again, Miss Bonnie, for taking time to be a part of this special video.
Thanks to Steven from Tostemac for having me on your channel. This was so exciting to collaborate on this and share what music therapy looks like for your audience. The business is Rhythmic Roots Music Services. You can find me on YouTube, on Facebook, on Instagram. And I post my own content too. I'm sharing different songs that I use in music therapy and music lessons. If you want to subscribe to my channel, and then you can learn a little more about kind of what music therapy might look like in application as well with some of my specific clients. I like to talk about that and then kind of present a song that I've written to use in sessions. Thanks again so much for having us, and have an awesome day.
And don't worry, I'll make sure to leave a link to the website in the comments section down below. And if anyone else has any questions about music therapy that we didn't answer, let us know and we'll try to get back to you as soon as we can. On that note, it's time to end the video. Thank you very much for watching, everybody. If you enjoy what you see, consider subscribing to Tostemac and clicking the bell icon to stay up to date in our latest videos. And until the next one, see you later.